Hi there. Welcome to the channel. My name is Alana, and I'm the creator of the Health Analytic Insights Podcast, where I interview guests and talk all things health
So in this
informatics.
video, I'm going to go over some tips to help format your resume. I've reviewed several resumes from people looking to break into or transition into the health informatics field, and in this video, I'd like to provide some general advice I provided to them. When it comes to applying for the analytical side of the health informatics field, you might see job postings such as business intelligence analyst, reporting analyst, report developer, system analyst, and this might be a few of the job titles you might see when it comes to the analytical side of health informatics. Some common skills you might see posted in jobs include knowledge of SQL to query relational databases, experience with visualization tools such as Power BI, Tableau, Qlik, etc., experience working with large clinical data sets, and the ability to work both independently and in teams. So you often see an importance on SQL as a programming language, and this is because this language is often used in health informatics. But what I will see when it comes to people's resumes is I'll often see people just listing some of these technical softwares such as SQL, Power BI, Tableau, but not really expanding on what they've done with this technical tool. So for example, you might have experience with Power BI, but how was it used? You might expand in a way such as developed a Power BI report, which tracks hospital key performance indicators such as 30-day readmission rates and was able to observe a reduction in these readmission rates by 10%. So really quantifying how you have used these tools instead of just listing them in your resume would be key. Another tip would be to create a clinical business intelligence portfolio where you go about solving a clinical problem by using one of these technical skills. It could be using R, SAS, SQL, Excel, etc. But developing a project from start to finish and compiling your steps either through a GitHub account or compiling it through a website and then linking to that in your resume can really show hiring managers that you have the experience in these technical skills and you're not just listing them for them to guess what your level of proficiency is. And don't worry if you don't have experience with advanced visualization tools. Just being able to have experience in Excel, building pivot tables, and creating visualizations in the forms of charts and graphs, and then presenting it to stakeholders would also be beneficial to add to your resume. And when it comes to experience working with large clinical data sets, it's also key to even name the data set that you have experience with. For instance, during my master's, I worked with a data set from the CDC called the Pregnancy Risk Assessment Monitoring System. And in my resume, I make sure to highlight the name of this data set so hiring managers can look up the data sets if they so wish to get an idea of this and the sense of the scale of the data that I've dealt with, and maybe even get some understanding into the types of data cleaning methods and tools that I might have had to use to get this data into a workable format. And then finally, the ability to work both independently and in teams is key in the health informatics field because you'll often be working with people who have both a clinical and or a technical background, and being able to have meetings and do presentations for stakeholders, get constructive feedback, and then carry out your analysis is very important. So being able to point to in your resume where you've had that collaborative effort is key as well too. So really just expanding, not just listing things, but pointing directly as how your previous experience, whether that's work experience or through your master's, is directly related to some of these key skills you might often see displayed in job posting. So when it comes to the more training side of health informatics, you might see roles such as a clinical analyst, clinical support, principal trainer, EPIC or EHR analyst. And these roles might involve experience teaching or helping guide patients, clients, or clinicians through new system upgrades. And this is where if you don't necessarily have clinical experience, but you might have experience in the hospitality industry or financial industry when it comes to change management, this would be good to highlight on your resume as a transferable skill, especially if you have any experience as a project manager or as a business analyst. This again would be great to highlight on your resume because these are very great transferable skills that can be used within a clinical setting. And something that I saw on some of the resumes that I reviewed is that people really had advanced experience working with these EHR systems, whether it was, working with Epic or Cerner. So really highlighting if you have that experience as a super user of an EHR system is a really great thing to highlight and develop on how you help to train users, or if you developed even any training materials for users in a previous job role. And then if you have experience documenting within an EHR system, make sure to expand on which specific software vendor you used, especially if you're applying for a role such as an Epic analyst and if you have experience working with Epic. And then making sure to expand on if you had any chances to improve clinical workflow processes or train other clinical staff when it came to documenting within the electronic health record. This can really help to boost your application and show your proficiency within this area. And then lastly, if you have any experience with any Epic certifications, that would also be good to include in some of these roles. So I hope this video was of value to you. The main point is that many of the resumes that I reviewed, they had a lot of good content, but what was missing from it was really expanding on the tasks, using quantifiable information and really making the connection between what was in the job posting and what was on their resume, and making sure that the hiring manager didn't need to guess if they had transferable skills, but really clearly outlining how they use the softwares or tools within their previous role and how it's directly related to the job postings that they're interested in. So don't forget to check the description box below to download your free guide to walk you through the process of starting your career in health informatics. Thanks and have a wonderful day.